Hi, my name is Brandon McSherry. I'm doing a presentation today on the Alzheimer's disease. We're going to start with what actually Alzheimer's is. It's a form of dementia. Dementia is a disease that unfortunately happens to a lot of individuals when they turn to an elderly age, which is about 65 and over. Alzheimer's is the disease that makes up 60% of dementia. It's basically it's not when you lose your mind, it's when you have increased confusion, increased memory loss, different things like that. It's described as the thief of the mind. That's how the disease is sometimes described. And Alzheimer's makes up 60% of all dementia cases. I believe that this is a very important topic because as a whole, we're all getting older. We will all eventually reach that age of where we are in the part of the elderly population. And so there are some of us that will unfortunately have to deal with this disease. Now, this disease, it doesn't have any cure. It just has ways to maybe slow the progression, how to increase the quality of life overall, but it's not the end all be all. Don't think about it as the end of your life. Think about it as the beginning of a new journey. As I've said a couple times already, there's no cure for the disease whatsoever, unfortunately. There are some risk factors that you want to keep in mind when you're aging, I guess. One of the major risk factors is a family history of having the Alzheimer's disease. It has recently been found through genetic testing that there is this thing that they're calling the Alzheimer's gene. And if your parents have it, there's a 50% chance that they'll pass it down to the child, and unfortunately, the child is also at a 50% chance of being diagnosed with the disease. Now, that doesn't mean to say that the child can't have a great quality of life, and they might not even end up having to deal with the disease in the long run. There's also the history of a head injury. Now, we all know head injury, any sort of head injury is not a positive thing. But when you think about head injuries, it predisposes you to brain cell death, which is basically what Alzheimer's is. Alzheimer's is a neurodegenerative disorder, which means that it's when the brain cells are dying at a faster rate than a normally aging individual. So any head injury is going to predispose you to having any sort of premature brain cell death. The same kind of goes for heart disease. I know we don't really think about the heart disease and Alzheimer's being basically related. When you think about it, your heart is pumping out all the blood throughout your body. Your brain, it uptakes a lot of blood in order to keep it strong, keep it sharp. But if your heart's not able to pump enough blood, then that means not enough blood's getting to your brain, which could predispose you to also having premature brain cell death, which could put you at risk for developing Alzheimer's disease. For the disease, early diagnosis of the disease is key to having a better quality of overall life. And through early diagnosis, you can better understand the process before some of the symptoms start arriving. These symptoms, warning signs of Alzheimer's, as I got up here on my poster board, include memory loss, difficulty performing familiar tasks, problems with language, disorientation, poor or decreased judgment, problems with abstract thinking, misplacing things, changes in mood or behavior, changes in personality, and loss of initiative. Now, I know these all seem like normal things with aging, but it's more in depth, it's more severe. Any family members see it. It's not just forgetting maybe something at the grocery store that you had on your list. It's more or less forgetting to eat breakfast, forgetting a family member's name, forgetting stuff like that. Or it's when your family members or caretakers can see differences in your mood or behavior. It's not like a day where you don't get enough sleep and then all of a sudden you're having a bad day. It's over a period of time you see that someone is changing. Now, as I've said, there is no cure to this disease, but we can try and help slow the progression of the disease through early diagnosis. From there, we can maybe help out with how some person will process the disease, how they'll get through the disease, different routes to take down the path of this horrible process. Through through slowing the progression of the disease, we usually use different medications like Namenda or Aricept, and they can help slow some of the warning signs, some of the symptoms that come about, like confusion and whatnot. But they're more on a long-term basis, not on a symptom-to-symptom basis. Things that help different symptoms are like non-pharmacological and pharmacological therapies. Now, a major thing going recently is non-pharmacological therapies, which is mostly aimed at reducing symptoms like confusion, agitation, anxiety, things like that. And some of the non-pharmacological therapies include like art and aromatherapy, music therapy, pet therapy, massage therapy. I know here at the nursing home that I work at, we have pet therapy that comes in, I think, twice a month, and they come around with the service dogs, and all the patients, they become all happy, and it changes the mood of the whole entire unit drastically. We have a wonderful activities department here at Wingate, and they do a great job with aromatherapy and music therapy, which helps reduce any anxiety, any agitation that patients may be feeling at the time. Unfortunately, it's not always the case that non-pharmacological therapies can be the most effective. So sometimes we need to use medications to help treat some of the symptoms. We have the use of antipsychotic medications. That's for more or less long-term confusion. We put those on like a scheduled basis, so they work up a better effectiveness with each patient. It's for long-term confusion and agitation, so they have less instances of these episodes. Now, on an episode-to-episode basis, we might use anti-anxiety medications on an as-needed basis, which is like using an Ativan, using Xanax, and that's for if they have instant, quick episodes of agitation or anxiety. You need to get them down from those high levels of anxiety, because no one wants to be feeling that type of anxiousness. I don't know if anyone's ever had an anxiety attack or anything like that, but no one wants to be in that state of mind. Now, as I said, unfortunately, this is a horrible disease with no cure. There's only ways to manage it. There's only ways to monitor for it. Early diagnosis is the best way to start the management of this disease, because with early management, you can have the best quality of life. At this time, I'm writing a paper that I'm just about finished up with. I will be posting that on my website, and you can find my website linked to my Twitter handle at McSherryBrandon. It has all this information plus a lot more information that goes in depth with the management and progression of the Alzheimer's disease. If there are any questions, feel free to ask.
I have a couple questions. So you said there's no cure at this point. Are they doing clinical studies on different ways to find like different drugs that might help out with this disease?
They are. The government does fund studies towards trying to find a cure for this disease. Fortunately, a lot of people believe that they aren't putting enough funding towards it. I didn't go in too depth of research about how much funding we're actually doing towards it. I know there's the Alzheimer. You can go to the website Alzheimer's Association.com, and you can get a lot of good information there. I believe it's something that we should put more funding towards, because, as I've said earlier, we are all getting older. We're all going to hit that age range. Any other questions? Yep.
How does it affect life expectancy if you say, the disease sometimes kicks in around 65, 70 or so? Am I going to live with Alzheimer's until I'm in my 80s, and how?
Well, it affects everyone a different way. Like, everyone has their different routes of dealing with the disease. As I said, early diagnosis is key in managing the disease. Each person will unfortunately go through the disease differently. We have some people that they lose the initiative, as I talked about with loss of initiative. We have some people that lose the initiative to want to eat or drink or something like that. So then you need to talk with the family, their power of attorney, and see, do they want to put in a G tube to force feed them? Do they want to start IVs, maintain hydration? and then you gotta go about what the quality of life is for that patient and see if that's how they really want to live out their days. But there are some people that still have 100% appetite every single meal, and so they'll keep on eating and eating and eating. But then there's other things that come into effect, like if a patient falls or something like that. Because then if a patient, it's known that a patient over 80 years old, I want to say, if they fall and break their hip, their prognosis is probably about 3 months, whether they have Alzheimer's or they don't have Alzheimer's, just due to the old age and the healing process. Now, so it all depends on different things that happen like that. It's not just one, I can't just give you one set answer of, oh, it's going to be about 10 years. Plus there's the 7 different phases that range from very mild to extremely severe. Those are the phases of Alzheimer's that you can find on alzheimersassociation.org. And so there isn't just one set time. I guess that's both good and bad. It just affects everyone in a different way.
Because someone could have, lose their mind, but still their body could be with it, and they could be really strong if they continue to eat or continue to exercise or get up and walk, so they could have it, their body could be fine with their head.
Yep, everyone's got a different disease process.
Right.
And it affects everyone differently.
To piggyback off his question, can you get Alzheimer's before, say like in your 50s?
Oh yeah, that's early onset Alzheimer's, which I've seen a couple of patients with that. That's especially hard on both caregivers and family because it just sometimes happens. I've heard stories where someone just goes in for a routine surgery. They have a family history of the disease, but they go in for just a routine surgery. They go under on anesthesia and they just never come out the same. They come out with dementia and then it progresses from there. Now, it can really happen at any time, but that's why early diagnosis is great, because then you can start the management of the disease. And if you have a family history, you can actually have genetic testing done to see if you're going to carry the trait or not. Now, I know for some people that's scary, and for some people they don't want to know if they're going to come down with Alzheimer's, but I feel that it would be better to know than not know, because then you can start with the management of the disease prior to actually coming down with the actual symptoms. Are there any other questions?
Nope.
And as I said, Alzheimer's isn't the end. It's the beginning of a new journey for most people. Just being on that journey is a tough roller coaster. All right. Thank you, guys.
Thank you.